experiences with COVID during the pandemic?
My personal experiences with COVID, they haven't been very happy ones.
Okay, could you just mind your head if you just sit down for me?
Yep.
And
Okay.
if you just, what has been your personal experience of COVID? Have you had COVID?
Yes, I have.
And I have to leave my mask on.
Yes, please. Yes, thank you. Okay.
Yeah, and I'm a vaccinator, so I had my vaccine on the 15th of January, which was my birthday.
I have seen patients contract COVID and unfortunately pass from them. Yeah, I just remember seeing people being wheeled away in oxygen masks, and that was the last time I saw them. I had literally, I think it's 87% of my patients having been COVID positive. Along with that, as you could imagine, I also had the staff being COVID positive. I remember seeing a colleague and I said, "Oh, where have you been? I haven't seen you in forever." And she was just like, "Oh, I had COVID, I almost died." And it just came out like that, and I just sort of stopped in my tracks and said, "What? What did you just say?"
So when I had COVID myself, I thought I will be getting better just taking some paracetamol. I end up in Maidstone Hospital. I was there for 2 weeks. I could not stand up. I could not talk. I could not even feed myself. I was so breathless and I was so worried, so scared, because I never thought COVID will affect me so much. My brother, he's an elder brother. He's like a father figure to me, because when I had COVID, he was running around everywhere, looking after me, bringing food to the hospital, and, trying to support me and my family as much as he can. But suddenly in December last year, he had COVID, and his wife had COVID, both of them. The wife got better, but unfortunately, I lost my brother.
My personal experience with COVID was I actually contracted COVID in November 2020. I then started coughing blood, and that was really shocking. Ended up developing COVID pneumonia, ended up in hospital as a result. Working in the healthcare industry as well, I realized that was another vulnerability, because I came into contact even during that time with more people than the average person was coming into contact with. So it was a real possibility that I would or could potentially lose my life.
So in November last year, the family had COVID. It started with my husband. Unfortunate for him, he got really worse, so we had to take him to hospital. He didn't really get better, especially with his walking, until last month. And he was telling us about, while he was in the ward, what he saw was very scary. He was very emotional for the last 3 months, to be honest. And what he said when Christmas, "I'm just glad to be alive." That's all he said, but yeah.
It was well published, well recorded that the BAME community was hit quite hard by COVID. Now there's a vaccine. I can see why all the questioning around, why will we as BAME individuals not be running towards the vaccine?
Within the Black community and the BAME community, there is a certain level of mistrust and distrust within the medical field. And that is backed up by statistics.
So my family back home are reading all these propaganda about this scaremongering about vaccination side effects.
You're gonna have your DNA will be altered. You're gonna be accepting some kind of weird thing in your body that will change your personality. You're gonna die. You're being used as a guinea pig. There's a lot of negative things out there. So I am a person of faith. I'm a Christian, and that has come into play. There were ideas that the vaccine had to do with the Antichrist. There were other ideas that the vaccine wasn't halal with Islamic beliefs. I wasn't gonna get it done. And then I thought about it. And then I considered my career, and I considered what I would be doing, because I'm a student nurse. So I thought, I'm going to be traveling to many places in different wards, meeting different patients. I'm going to be going to people's homes in the community, doing placements there. And I thought about the levels of risk, and it was really making me feel unsettled, not being protected going through that. I also considered my health, because I'm asthmatic. I had friends who were in research, so I had friends that are biomedical scientists and who were very familiar with the vaccine, and I bombarded them with texts, and I said, tell me everything you know. I researched articles, read through the data that's been published, and I was satisfied, and I said, even if the risks didn't seem as bad as me contracting COVID would be.
I had to kind of lay it down to people, look, I'm a black girl, I'm a Coco Chanel, I can ask the questions. I would ask 5 questions before you can get one rationale out. But if you're patient and you listen to the question that's actually not been asked, you'll get more of us on your side. I took the vaccination for a number of reasons, because they needed to know. Sometimes all you need is a bit of guidance. All you need is a bit of, oh, you actually did it. You're still alive. The proof is in the pudding for us.
But because I didn't have the vaccine, I'm able to then say to them that, have you thought about taking the vaccine? And have you thought about the fact that the positive things you're going to get from taking the vaccine, it outweighs these things you're talking about? I have been able to debunk a lot of myths that people have.
I've had both my vaccines. I had my last one on Saturday. Having experienced both, it's better to have those mild side effects, that mild headache, than the month I spent laid down with COVID or COVID pneumonia.
My personal view is the best thing is to have the injection. Even now, looking back, even at my brother, if that would have been there earlier, he would have not passed. We wouldn't have lost him.
Before I had the vaccine, I was shielding. It was affecting my mental state, my health, my well-being. I really wanted to go to work. I really wanted to go out there. I have underlying health conditions, and also I'm BAME. So I think, yes, that really gave me a lot of reassurance.
That's the site where I had the vaccination. I don't have 4 heads. I'm still the person, sad for some, noisy, bubbly, jovial. I'm still that person.
The way I saw it as is it's the way for me to keep living my life according to my beliefs and to keep serving people as I've been doing and as I've committed myself to serve people, but to do so safely.
And I became a vaccinator because it was important for me to be there. It was important to be a BAME nurse. The members of the public coming in, they would ask me, and I could answer as a BAME member of staff. I could answer as a BAME individual. You know, there were no side effects that were screaming any alarms.
But what I would say to someone who is who is unsure about receiving the vaccination, I would say, of course, it's your choice, but I would say definitely do your research and consider the reality of COVID-19. I know there's a lot of misinformation going around. I have had some conversations with my family, and the story is changing because I think that more the statistics are in, people are more comfortable with the idea of it.
Speak to people at work, speak to the NHS about your doubts and fears, and be sure of your source of information before you make that decision that could affect everyone you know and love.
The more of us who have the vaccine, that would enable us to function like we should function as human beings. We are social beings. We are meant to interact with people. We are not meant to be locked in our houses.
There was never a time when I had any doubts about taking the vaccine. I felt that it was my responsibility as a citizen, first of all, to protect myself and to protect other people.
You've got the right to have concerns. It's just really to say that it is okay to be curious. But like anything else, if you're going on your journey, you get up, you plan your journey. I think we've got a social responsibility to each other as the BAME community to make sure we're getting it right.
I had my vaccination.
Of course, I've had my vaccination.
I've had my vaccine.
I've had mine. Have you had yours?
Information around COVID vaccination is available to you on iConnect, and also our pharmacy colleagues are available to answer queries, and of course I'm available to all staff at any time Please email me if you have any concerns or queries related to COVID-19 vaccination.